The best part of my job, I think, is just talking to my patients. I love meeting new people. I love seeing them long-term, establishing these long-term relationships. Everyone is so different, so diverse, and so interesting in their own way. Getting to know them as people and being able to help them, every step of the way, I think is really special. So I think Compass is a really unique because it's really community-based. They're not affiliated necessarily with a big hospital system. So I think they have more of a sort of personal feel. I've heard from so many patients that every single person that they meet is so kind and welcoming and supportive. And I just think it's so special to be able to work with this group of people that really just truly cares about patients and puts their needs first. I work in a team with several physicians and physician assistants. We are involved in pretty much every aspect of care of their care. I think team-based care is extremely important in oncology because patients with cancer, they have a lot of needs, and it's really difficult for one person, one provider, to meet all of those needs. So I think my role specifically as a physician assistant is really special because I get to see patients and I generally am able to have longer conversations with them. I think it's really beneficial for patients to have long-term relationships with their providers because it really establishes trust, and I think that rapport is really helpful, especially when you're taking care of patients with cancer. I think gynecological malignancies can be just so deeply personal to women, and I think just having that trust with their providers is really, really important in helping them get through. I feel really, really fortunate to be able to come on at this point in time and work in gynecologic oncology. There have been just huge advancements I think in this field in the past 10 to 15 years or so. One is robotic surgery. So that has significantly improved recovery time for patients who undergo hysterectomies. There are also several advancements in the drugs that we use. Very promising and effective drugs available now that were definitely not available 10, 15 years ago. They have really been shown to extend life and quality of life in our patient population. So it's really exciting to, be in this field at this time. I just feel really fortunate to be able to contribute in my role as a physician assistant. My favorite part about coming to work is being able to talk to my patients and get to know them and figure out ways to help them, whether that's directly related to their cancer treatment or otherwise. I'm not exaggerating when I say that, my patients are the strongest people I know. They're able to take these really difficult diagnoses and they don't let it define their lives. And it's just really a privilege to be able to help them through this really difficult journey. I also feel extremely fortunate to work with some of the most kind and compassionate and smart people that I've ever met. I just feel really grateful to work here at Compass.